There are only a couple of vendors out there when it comes to sacral modulation in urology for multiple indications. I'm very, very honored to have Gabbi here with Axonics, and she's going to talk to us about what is new with their implantable device in the area of overactive bladder and among other indications. So thank you so much for letting me catch you at the very end of the Arizona Urologic Society meeting, and thank you for staying a little bit later.
Absolutely, my pleasure. Thank you, Dr. Lin.
So tell me what is new, or better yet, I know there are only two products out there for this space. What is new with Axonics?
Definitely. So basically, with our two implants, they are 30% smaller than the competitors' implants. Additionally, we have a rechargeable that it is, and I'll kind of show you a little, I have them here, so
Nice.
why not? The rechargeable, it's about the size of an Andes mint. Um, on average, will last in the body 20 years plus. So as long as you get the milliamplitude set appropriately, then this will be lasting in your patient for a long time.
20 years. You charge it once in the last 20 years.
Yeah, and so you would charge it once a year.
Oh, got it, got it, got it.
But the stimulation, the battery itself will last 20 years on average.
Got it. The lithium battery lasts 20 years. That's awesome. And it looks like it's inductive charging.
This is the charger here. You would just line it up with the scar, and then it's about, 30 minutes to an hour charge when they do have to charge it.
Kind of like what I do with my Android phone.
Yes, very similar, right, with the charging dock.
Yeah.
Mhm.
And that is different than the competitor.
Yes, it's different in the fact that the battery lasts longer and that you charge less frequently. So only once a year with ours.
Okay, so you basically charge it once, it lasts longer, and the durability of the lithium cell, I assume is the lithium cell inside, also lasts longer. You said 20 years before the patient has to deal with it, before the urologist has to deal with explanting and implanting.
Exactly. Exactly. Yeah. So, and then the explant time is not an issue or anything. You just go in, open up that pocket again, swap out the battery.
Yeah, I'm sure by that time there's a capsule that's forming around it, and it's pretty easy to dig it out and install a new device.
Definitely. And then additionally, our other battery we have.
This looks like a car key
Bob.
fob.
Yes, so this is our remote. This controls the batteries. So either battery will come with this. This is the recharge free option. So this is an average of 15 years in the body before you need to swap out the battery.
Meaning you implant it once, you leave it in for 15 years, up to 15 years, and then that's it. No recharging.
Charging or anything. Yep, no charging. And then same with this remote. So, in comparison to the competitor has a remote and a programmer as well, but it's the size of a cell phone, and the patient has to charge both of those things. So it's just one other thing your patient, which are generally older patients, are kind of struggling with.
I'm all about decreasing friction to have whatever the patient to adopt or to physician to adopt whatever the newer and better technology is. Sounds like you have really addressed some of those issues.
Absolutely. The biggest thing when I came over to this company, even, is just they want the patient experience and the office experience to be seamless. So, Axonics' goal is to take all that follow up with the patient that the office feels. A lot of the offices don't want to manage OAB patients. It's a lot of follow up, there's a lot of back and forth with programming, complications. But I will say also, just a little plug, our patients at 6 months, 94% of them are on the same program that they leave the hospital with. And so there's less fussing with programming with us because we have a proprietary algorithm that actually allows us to optimize the best electrodes and circuit within the patient there. But yeah, so sorry, little tangent. Excited about the
Yeah,
product.
that's great.
So with the remote, though, it's so simple. They don't have to charge it. It's easy access, and our team actually will consult the patient over the phone if there's any issues initially. So they know, don't bug the office, come bug your rep. Humbug are clinical, and they have a therapy support specialist even that will follow them out 3.5 years to just check in post implant. So it's going that extra mile, letting those patients know, oh, my team isn't only Dr. Lynn, it's also Gabby, and I need to reach out to Gabby first, and she's going to help me navigate if I need an MRI, if I need, is this like a programming issue with the battery, or is this I need to go see Dr. Lynn because something else apart from the battery is happening?
It sounds like Axonics is addressing the concerns of not just the patient, but also the practice, as the practice margins have continuously decreased throughout the years. You are being empathetic to how we need to operate so we can impact and maximally benefit as many patients as possible.
Absolutely. And, I think just as it makes me feel good to work for a company too that is thinking about, I see the stress that you guys go through, everything you have to juggle, the offices, you're spread thin with, the staff turnover, just all the things we've faced in recent years. And it's like Axonics sees that and is like, you know what, let us help you, let us take this off because this is a proven therapy that can help patients, and let's give you the opportunity to optimize your practice flow, which I know you're very efficient. I've seen it and it's beautiful how you run your practice, but efficiency is time and money, and we're taking a huge piece off
Yeah.
of you guys.
And it allows us to impact and positively impact on more patients whenever we get the support. And truly, this is a team effort. I've known you. Seems like you pick some good companies. Last company was NeoTract, and now you're with Axonics. You pick some good winners, shall we say? So a lot of my members or people who watch this video are in coding and billing. What are some of the suggestions you may have when it comes to coding and billing for Axonics devices?
Absolutely. So as far as coding and billing goes, it's going to be the same coding as the competitor. So there's nothing new when it comes to that. Additionally, if you're new to sacral neuromodulation, I'll come in, or my different teammates in the valley will come in and make sure it is clear cut so you understand, hey, just X, Y, and Z are the codes. Additionally, we're covered by all insurances, so there's no issues with payers or reimbursement in that sense.
Yeah, you don't have to worry so much because it's the same CPT, so you don't have to worry about the local coverage determination, coverage article, and national coverage determination. It's an established payment tract and
Yes,
established codes. So there's not as much guesswork when a practice adopts Axonics versus the competitor.
exactly, exactly. So yeah, no issues there. If you're already using the competitor, the coding and everything will be exactly
What
same.
about a newer coder, newer urology coder who needs a little bit more handholding? What other resources do you have?
Yeah, no, we have very thorough reimbursement guides. We also we can come in and get a reimbursement specialist involved and make sure that everything is clear cut. So there's not going to be any issues
It looks
for.
like you have something
I
on
do,
your handout
yes,
that.
I do. Yes. I have a few things. So, there's like a um, frequently asked questionnaire in here. Um, as far as, it's going through prior auth steps, differences between explantation, what codes you're going to bill here and there, what's appropriate to bill for programming. And so the nitty gritty is definitely all paved out, and there's not going to be any issues with that. And we also have not only for in office, so you can do the trial tests in office, but you can also do them at an ASC, excuse me, or OR. Um, and there's a whole other guide as well to breaking down hospital ASC, and we'll be there the whole step of the way. Like I'm very involved in it.
Yeah, so it sounds like whether or not you're coding for the whether you're coding for the office or the surgery center, seems like I'm seeing this frequently asked questions pamphlet. It covers all the questions that you may come across when it comes to coding and billing. It sounds to me that this company is very empathetic to the practice as well as the patient. So really appreciate you coming on here and sharing your insights regarding Axonics.
Yes, no, it's my pleasure. Thank you so much for taking the time to just give a little blurb. And I look forward to supporting anyone's patients out there. We have a great team. Has years of experience, very good demeanor in front of patients, which I think is important, right?
Absolutely.
With this role, we'll be there pre and post with the patient. My background personally is in social work. I'm very comfortable having difficult conversations, navigating, upset patients. Not that I'm saying they'll be upset, but
Difficult, challenging patients.
challenging,
Yeah.
yeah. So,
Well, thank you so much. And as always, if I have any financial interest in any of these companies, I will disclose that. I have no financial relationship with Axonics, just sharing insights and stories and things that I see on the road. Take care of yourself, take care of each other, and thank you for the privilege of your time. Thanks, Gabby.
thank you so much, Dr. Lynn. Have a good one.